Hi everyone, welcome to Pathopulse underscore Radhika. So the question for today is a 25-year-old female presented with a mobile lump of size 3 by 3 centimeter in her left breast. There is family history of breast cancer and FNAC from the swelling in the left breast showed the following. What's your possible diagnosis? Okay, so basically it's a young female with a mobile lump in the breast with family history of breast cancer, and this is the FNAC finding, and the options are phyllodes tumor, invasive ductal carcinoma, fibroadenoma, lipoma. So this is the FNAC picture from another field. So what are you seeing here? Any guess? So basically you're seeing a cohesive pattern. What do you mean by cohesive? Cohesive means something which is very adherent to each other, like they're attached to each other. You see a cohesive fragment of cells. Okay, what do you see here? Here again you see a lot of fragments, they are also cohesive. And what are you seeing here? So he's something like a basophilic material, a bluish material. This is nothing but the myxoid fragment. Okay, we call it as a myxoid fragment. Here you have benign ductal epithelial cells, and if you carefully notice at the back you have some small singly lined nuclei. Those are called bare nuclei. They're called bare nuclei. Okay, so this particular fragment is an important clue for a diagnosis of one of the following. What is it? So this we call it as a fibromyxoid. Sometimes it can be more myxoid as well, right? So here you have a cohesive fragment. Does this resemble anything? So you have a cohesive pattern of cells with myoepithelial cells at the periphery, the dark staining cells, and you have a fibromyxoid fragment and a bare nuclei. So always remember, when you see this fragment with a cluster of myoepithelial cells in a branching pattern, this resembles like a Staghorn pattern, like that of a horn of a deer. Okay, so this is called antler horn pattern or a Staghorn pattern with a fibromyxoid pattern. Your diagnosis is fibroadenoma, which is a benign fibroepithelial lesion. So memorize this picture, take it into your mind. This is how a fibroadenoma looks like. So you have a branching cohesive pattern of cells with a fibromyxoid fragment, and you can have bare nuclei. So bare nuclei, you can see it in other benign conditions also. Now, if you go to the hyper, so this is how a typical antler horn appearance will look like, right? Like the horn of a deer. So why have I put this picture? Because in the periphery, so if you carefully observe, look here, there is some difference in the cells in the periphery. So here you have all cells which are looking like this, which are round to oval. But if you look at the periphery, are able to appreciate they are flattened or spindle shaped cells. These are myoepithelial cells. So usually the presence of myoepithelial cells indicates that the lesion is benign. There are few exceptions, you need not know that as of now. So for your level, whenever you see a myoepithelial cell, it indicates the benign nature of the tumor. So in malignancies, you don't see this myoepithelial cells. So this is one of the important feature you should remember. So loss of myoepithelial cells indicates a feature of malignancy, right? So far what we have learned about fibroadenoma is usually it's a mobile lump, so it can move around in different places in the breast, so it's also called breast mouse. So pertaining to pathology, it's a benign fibroepithelial lesion. It's a benign fibroepithelial lesion. And on FNAZ, what you can see is the antler horn or a staghorn appearance of cells with myoepithelial cells. Then you can have fibromyxoid stroma. You can have bare nuclei. Okay, so all these are features of fibroadenoma, right, which is a benign fibroepithelial lesion, right? So anything else which goes by the name Staghorn in medicine? I hope most of you will guess this. So Staghorn or antler horn pattern of cells in cytology is seen in fibroadenoma of breast. This is a X-ray which is showing a calculi in the kidney which is also appearing in a Staghorn pattern. What is this? So this is called Staghorn calculi. So what you need to know about Staghorn calculi? So what happens in the kidney? You have your cortex, your medulla, then you have the renal calyces, right? So these calculi take the shape of these kidney. So they appear like a Staghorn. Okay. So most of the time the Staghorn calculi is composed of triple phosphate. So it's composed of triple phosphate. So what is triple phosphate? So it's calcium, magnesium, ammonium phosphate. Okay, calcium, magnesium, ammonium phosphate. So this you should remember. So there is one particular special feature about this calculi. What is that? So most of the calculi form in an acidic urine, whereas triple phosphate forms in an alkaline urine. Why? Because this is usually associated with infection by Proteus. Okay, so if you have learnt in microbiology, you all must go and read about Proteus today. So Proteus can produce an enzyme called urease which can cleave the urea to ammonia, right? So what happens? This produces an alkaline urine. Okay, so the urine will be usually alkaline in Proteus infection and it's usually associated with a triple phosphate calculi. So the other name for Staghorn calculi is triple phosphate stone or as triple phosphate calculi. Whereas in urine cytology, if you centrifuge the urine and look under the microscopy, if you have a Staghorn calculi, you have coffin lid shaped crystals. So if you look under a microscopy, you can see this crystal. So this again is an important question. So triple phosphate calculi will be coffin lid shape. They will be coffin lid shape. Okay. So this is another important thing in Staghorn. Okay. So another thing. So let me tell you, this is a bone marrow aspirate from a patient who presented with burning pain in the feet, legs, and then he had thrombosis in the portal vein. So any guess what it is? So this is called Staghorn megakaryocyte. So what do you mean by Staghorn megakaryocyte? So when you normally look for megakaryocyte in the bone marrow aspirate, how do they look? So they will have multiple nuclear lobes, okay? So they will be connected to each other. About 4 to 5 lobes can be there or sometimes 6. But what happens in essential thrombocythemia? This lobes will be like branching and branching like that of a horn of a deer. So this can be seen in essential thrombocythemia, which is a chronic myeloproliferative disorder. Okay, it's a type of chronic myeloproliferative disorder, right? So have you heard about CML? So all these comes under chronic myeloproliferative disorders. Okay, so as of now remember this, and this particular condition can present with erythromelalgia. So what do you mean by erythromelalgia? You will have burning and throbbing pain in the hands and feet. So due to mutations you have increased platelets, right? So this increased platelets are abnormal, so they can cause thrombosis, they can cause bleeding also. You have to go for some mutational analysis to confirm essential thrombocythemia. And the megakaryocytes in the bone marrow will have multiple lobes which appears like a Staghorn. So these are the different Staghorns which you can see it in medicine. So Staghorn megakaryocyte is seen in essential thrombocythemia. Staghorn fragment of ductal epithelial cells can be seen in fibroadenoma, and Staghorn calculi is usually associated with Proteus infection, and it's a triple phosphate calculi which appears like a coffin lid shape. So we have seen about fibroadenoma, which is a benign fibroepithelial lesion, and you can have cohesive cluster of cells with myoepithelial cells, and you can have a fibromyxoid fragments with bare nuclei. So these are the features which you have learned today. Okay, so thank you so much for your patient listening and wishing you all a very happy new year. So some of you must not be watching this video on a new year, but anyways, have a happy new year ahead. All the best.